Hello, I'm Sarah Boylan, and welcome to our ePractice Manager webinar. Today we are here with Ms. Trish Nolan of Dental Systems Integrators to talk about telehealth, remote access, and HIPAA guidelines during the COVID-19 public health emergency. Trish founded her IT company in Portland, Oregon almost 20 years ago with a primary focus on serving the dental community. Her team provides a wide range of IT services from build-outs and network installs to ongoing tech support, encrypted email, backup systems, everything a practice needs to be compliant and protected. So, Ms. Trish, thank you so much for joining us today. I am looking forward to hearing what you have to say.
Well, thank you very much for having me. I really appreciate the opportunity to help disseminate some information that, is hopefully helpful to all of our doctors in this trying time. So hopefully I've got some good advice for everybody to hopefully help them get through all of this, and hopefully you won't have to use these kinds of remote access tools for very long, and you'll be able to see your patients again one-on-one. So today I'm going to talk about telehealth, remote access, and HIPAA guidelines during the COVID emergency. Everybody really knows what HIPAA is all about. I don't need to sort of go through that in finite detail, but HIPAA is essentially, it's still in effect. They realize there is an emergency right now, but they do want to make sure that you do have different systems still in place to help protect patient information. So the requirements include a risk assessment of your organization. If you don't have one of those, now would be probably a good time to put one together. They have a very easy outline of what a risk assessment includes, and especially now that your organization has changed slightly since you're going to be remoting in, probably a risk assessment is a good idea, an updated one, especially if you're changing how your office normally operates. Business associate agreements are still required. So if you don't have a business associate agreement set up with your IT company, they have free boilerplate outlines of a business associate agreement on the HIPAA website. And you basically have to just put your practice name in there and then their name in there. Anyone who has access to your patient data needs to sign one. And training your staff on the basics of HIPAA. So for the staff that you have that you're sort of keeping around a little bit and having them work, maybe have them get online and look for some webinars on some basic HIPAA training videos, and monitoring all the HIPAA updates. That's something. Those are the requirements of HIPAA right now that are still in place. I am going to be mentioning a lot about ePHI data. It's electronic protected health information. Everybody should be familiar with what that entails. It basically encompasses everything having to do with your patients. Even portions of their zip code is considered ePHI data. And your data is the lifeblood of your practice, along with your practice management system, accounting systems. So you still have to maintain it and make sure that it's being taken care of. And those are some of the things that I'll get into as I continue to go through the presentation. So these are the three main standards that are still in effect: your administrative standards, your physical safeguards, and your technical safeguards. And my presentation is going to focus more so on the physical and technical safeguards, because as an IT company, those are the things that we're mostly concerned with. Okay, so what is changed due to the COVID-19 emergencies? Well, you could always use video chat apps, but typically they were very specific ones that you had to pay for. Now that you're working from home, HIPAA has basically sort of relaxed temporarily some of their standards and guidelines to include text messaging, video apps. You can even use the video share on your phone, but you still have to keep in mind, when you're working from home, that you want to maintain a little bit of the patient's privacy. So step into another room. In the past, when you used these applications, they assumed that you were in your office. So there were specific things, specific guidelines about not going out in public. But these days, since nobody's going out in public, you'll be probably talking to your patients at home. So you want to maintain a little bit of their privacy and maybe go to another room, maybe not put them on speakerphone if your family's around. So these are the apps that are new, not new, but new to HIPAA as far as they are now permissible. Apple FaceTime, Facebook Messenger video chat, Google Hangouts, Skype, and basically they're leaving it up to you. Any apps that you determine are not public facing that you're comfortable with. So that could be the video from your phone. You know, if you're not sure about it, I wouldn't use it. So these next video apps, they are HIPAA compliant, which means that they have signed an agreement with HIPAA that they do protect patient information. So there's a lot to choose from there. You know, they tend to be a little more expensive, and they, you know, definitely charge subscription, and it's because you get that additional security. But if you feel more comfortable with one of these apps, I would definitely look into them, especially if this does, you know, continue for a few months. So the video apps that aren't allowed, and they're just not allowed under HIPAA, are Facebook Live streaming, Twitch, TikTok. I would even put YouTube or anything that is like hosted in a public arena. If you're not familiar with the app and someone contacts you with it, and you're not sure, it's probably best to contact, you know, to maybe say, well, I'll contact you back on this app, or, you know, whatever you're more comfortable with. I don't think that would be, right now, that would not be any HIPAA violations. Right now, they're basically suspending a lot of the HIPAA violations having to do with video apps. So an example of a public-facing interaction that wouldn't be allowed is, I've got, you know, let's say they post a personal question. Let's say they post a video with a question on there, and they just don't know that they're, you know, they think they're being high tech, and they're not, you know, they didn't realize that they were posting it on your wall and not inside your personal Facebook Messenger. My mom does this all the time. So it's your responsibility. You have to take things like that down from your wall, and it's up to you to protect the patient's privacy even if they're not doing it themselves. So like I mentioned before, if you're not certain about a particular app, then whether it's public facing or not, then I just wouldn't use it. I would use something that you're more comfortable with. Okay, so mobile computing. So right now, everybody's probably either taking their laptops or their iPads and finding a nice place in their home office and remoting in. Maybe this is you know, something that you take with you all the time. Like, you know, you just pop it in your car and maybe go grocery shopping. The thing is that when you're using mobile devices, that is actually has the highest incidence of theft out of all of the different HIPAA breaches, is when people steal remote devices. So when you have your laptop, you can't leave it in your car. That's a semi-secure area. It used to be a car, a gym, but nobody's going to the gym anymore. So it'd probably just be your car. So you should always keep your mobile devices with you. And that's another thing too, is if something does happen to your remote device and you don't have any EPHI data on your device, one of the things you can do is you can immediately contact your IT person and have them disable any remote access, so that then that laptop doesn't become, you know, something that you have to worry about, as long as there's no data on there and there's no way for that laptop to get into your office. So let's talk a little bit about remote access. So these days, usually, remote access is not something new. Typically, you've always had a computer set up whenever there's a snowstorm or inclement weather or a hurricane. But now, during the COVID-19 national emergency, we're finding that pretty much you should be using it more as far as getting into your system so that you can keep records of your patient interactions. There will be a lot of these codes that you can do when you're actually diagnosing your patients that you can actually bill for. So it's important to get them into the patient record. So, there's a lot of different options for remote access. We like ones that have two-factor authentication. And these are the ones that we see the most, and that they seem to be the easiest to use. They seem to have, fairly good pricing. TeamViewer actually has a free version that will let you log in with one PC, and it still has the two-factor authentication. So we tend to like that one too, especially if you only need to log into one computer. So two-factor authentication is really what you want to use when you want to get into the office, because you're actually using that third-party website to log into your office remotely. So you're not creating a direct connection. You're using the security from the third-party website to get into your office. And it definitely, when you open up this kind of connection into your office, you want to make sure that it's as secure as possible. So that's what you're looking for, two-factor authentication. If it doesn't say it has it, then don't put it on. RDP, we don't see as much of that anymore. That used to be a very popular way to get in. It's the built-in remote desktop utilities that are in Windows. They are it's very popular because it's free, but it's not secure. There are ways, because it's basically leaving a hole open in your network, in your firewall, where hackers can get in. And you don't want to leave that kind of thing out there, especially when you're not there most of the time. And, the different hackers, they might know that you're not there. So it's best, if you're using RDP to get into your network, it's best to go to something that is a little more secure. So talk to your own IT people about that. And, and sometimes it's like, maybe that's what you wanted because it was less expensive, but it's definitely time to move to something else, especially if you're going to be using remote access frequently. So while you're using remote access at home, same thing, when you walk away from your computer, you should either lock your keyboard or log out, just to keep, maybe your cat, or if you have small children, from getting into your computer and doing something that they probably wouldn't do anything maliciously, but you still have to safeguard the data. And we talked about that laptop. I talked about that laptop in the car. So if you weren't doing anything on that laptop at all, except remoting in, you can shut down that connection, and then you're perfectly fine. You have very little risk of any data being accessed by a malicious person who stole your laptop. And so the best way to do that is you remote in, and you can use the email within your office, because it's best to sort of have all that email in one location anyway. You don't want to have a bunch of email that you're saving on your laptop itself, because then you've turned that laptop from something that was just a remote access tool into something now that contains EPHI data. So it's best to not put any data, as much as you can, on any machines that are mobile that you're taking out of the office, or taking out of your home. Sorry, nobody's working in their office anymore very much. So if you have encrypted email, it's best to log in and then use it from your office. So we highly recommend that. So right now, I guess, there's a lot of hackers out there who might be a little bit, more bored and might be more creative. So don't open email attachments unless you're expecting them. We tell all of our offices to do that. These days, a lot of people that you even know have had their emails hacked, and they're sending you what looks to be legitimate, like a legitimate email. But unless you're expecting it, don't open it. If it seems a little odd, if it's something that you're not expecting. And don't click on the links of the emails. You can always hover your mouse over links, and it'll tell you in the bottom left-hand corner where you're going. So if they don't match, then don't click it. And only visit or download software from web pages you trust. See, these are the same cyber threats that have been out there for as long as I've been doing this. They're just, they just get a little more creative, and they think of more ways to get in. So definitely just be extra vigilant, especially with the phishing. Phishing are the emails. You're going to see a lot of COVID-19 emails that might look interesting, or some of these bills, they come in as bills. Right now, you're probably getting bombarded with bills because people are worried that now, since you're closed, they're not going to get paid. So the bill phishing things have looked very creative. If you don't recognize the vendor, don't click on it. Wait till they call you, send you a letter, something else. So I know it's hard. You're looking at finances these days, and oh my gosh, my antivirus subscription is up, and now I've got to, renew it. Well, yeah, you should renew your antivirus subscription, even if you have your machines closed. Just because you need to keep that enforced. It depends on your state dental association. A lot of the different state dental associations can actually override HIPAA recommendations. And a lot of them, I know in Oregon, and I do believe in Washington too, they say you have to have antivirus. So even though HIPAA doesn't specifically say you have to have this or you have to have that, if the state organization says it, then you should have it. So maybe work something out with your vendor who's supplying it. Say, maybe we can bill instead of 2-year increments, because that's what we usually do. Maybe bill them every month or every 3 months. So see if you can work something out that way, but definitely keep your antivirus enforced and up to date. So this is the physical security rule. So especially, you're not in your office, it's your server's there, maybe potential thieves, they know this, that your server's there. So it's been a HIPAA rule that you have your server either located in a place that has a door that locks, or a cabinet that locks, or that it actually has a physical lock, something to impede someone from just, breaking in and grabbing it and going. That's still a requirement. If you don't have that in place, those inexpensive laptop cable locks will do just fine to lock your server down. You just have to do that. Make sure if you're using hard drives that they're encrypted for your backups, so that even if people take them, they're basically encrypted, so they won't be able to get into anything. So this is, again, me talking about the physical access. That's what they're, when somebody breaks into your office, that's what they're looking for. Server is your most expensive machine, and that's where all the data is. So that's what they're going to be looking for. So on that same note, your server has all your data. So if you do currently have a cloud-based backup software, keep that in force, because as you remote in, you're changing the data, you're changing the patient records. Maybe work something out with your IT company If they bill you yearly, maybe ask them to change it to quarterly or monthly, while you're going through this crisis. If you happen to rotate your external hard drives, you're going to have to continue to physically rotate them, because if you do get a virus or ransomware, they'll not only attack your server, but they attack the hard drive that's connected to it. So if you rotate them, at least, currently, we recommend, every other day. But if you're not in that frequently and you're only seeing patients once a week, when you go in and see the patients, rotate your external hard drives so that at least one hard drive is not plugged into the server and that data is safe. If you have on-site backups that you're doing, a lot of people think that it's a HIPAA requirement that your data has to be in the cloud, but it really just needs to be off-site or secure. It has to be in a secure location. So a fireproof safe that's bolted down is perfectly acceptable to put your data into there. Or, now that you're not doing anything but going, home, maybe the grocery store, you could take your data home and it probably wouldn't be that cause that much inconvenience. So what we recommend is work with your existing IT company. I've seen just recently quite a few emails or things that go out that basically are, they want to scare the doctor and letting him think that the internet's become a worse place. It's no worse than it ever was. In order to maybe sell you some extra security packages. So if you've been working with somebody and they're reputable and they've been around a long time and you trust them, you could always ask them questions like, how am I set up? And basically, you can have them help you with your risk assessment plan too if you don't have one of those, because that's what we're there for, is to help put together a plan for you. So how, do you have a, firewall, a physical firewall? What kind of security things do you have in place? Do you have passwords? All of that. So, and I discussed the phishing and the virus and the malware. So, and that's another good point too. Actually, these days, even though the viruses and malware, they're more creative, you actually have less people now working in your office on any given day. Even if you're seeing patients on an emergency basis, you probably have a very small staff. So there's actually less chance of infection. So I don't really think there should be a lot of panic when it comes to that, but just trust who you work with. Any questions?
So Trish, thank you so much for that. I do have a couple of questions. Will the Department of Health and Human Services, would they inform us if there's any additional changes to HIPAA that will affect the way we work?
Oh, that's a good question. Don't open any emails that look like they're HIPAA-related emails that come to you, because HHS will not reach out to you directly. They specifically have said that it is your duty to check with them. And I think in the beginning of my presentation, I did put the HHS address with the COVID-19. They are releasing bulletins. So it's up to you to go out and check that on a regular basis to keep appraised on whatever changes they're going to be doing.
Okay, great. Thank you for that. And then the other question I had is, if I don't have remote access set up in my office already, do I need to physically be there to get it up and rolling?
Yes, unfortunately, you have to be inside the office at the machine that you plan to remote into in order to create the secure session. And basically, your tech doesn't really need to be there, but you should make an appointment with them ahead of time. They might be busy, and you want to make sure that, since you're only going to be in the office for maybe a short amount of time, that they're there with you. to help you set it up. And then the other good thing is they can also test the connection so that you don't have to go back.
Oh, terrific. Okay. So then I have one other question. What if I'm remote accessed into the system and then suddenly I get a notification that I have a virus or a ransomware message? What is the best course of action for me to take right then and there?
Well, it's hard not to panic whenever you see that. Even if you see that in your office as you're sitting there in front of a computer, you see that that screen of death popping up. Oh my gosh, ransomware, we need Bitcoins, all of that. So the thing to do is do not disconnect your remote session and leave your machine running with that going on. What you do want to do, if at all possible, is you want to, keep a level head and go to start and shut down the machine from your remote session, and that will disconnect your remote session, shut down the machine, call your IT person and meet them at your office.
Okay, great. Thank you so much for that. This has been
you're
awesome.
Sorry, I have a question as well. Quick question for you. Can multiple people remote into the same machine simultaneously? Like, so if one person is on the machine working remotely, can another person join, or is it only one at a time?
Well, unless you have what's called terminal services set up, and that's something that is a secure login that's through Microsoft, and you pay a lot for that particular service. And most of our offices don't have remote services set up. So if you're going to, it's not possible to actually do a session like that on just one computer. You really want to set it up on multiple computers is probably the best thing to do. So you might have to pay a little bit more for a multiple license. There are ways to do it, but we've run into issues with that in the past where you have one person physically working on it, but you can't have more than 2 sessions at once login.
Okay, great. Thank you.
Is that clear?
No, that answers my question. Yeah, thank you.
Trish, thank you so much for joining us today and sharing your insight on these topics. It was super valuable information. Thank you. If anyone has any questions, feel free to contact Trish directly, or contact information is on the screen. And of course, as always, you're welcome to contact us here at ePractice Manager. We have multiple resources to help you find answers to any of your questions, so definitely feel free to reach out to us. Thank you so much for joining us today, and we will see you next time.